Good day everyone! Today we will talk about tocolytic agents and drugs. So tocolytic, these are agents that inhibit uterine contractions. They relax uterine smooth muscle and may be used to delay labor and to stop threatened abortion. So we have three tocolytic agent examples and drugs. First is the beta-adrenoceptor agonists. The second one is the calcium channel blockers. And the third one is the oxytocin agonist. Let's start with the selective beta-adrenergic receptor agonists like terbutaline. As the name suggests, they stimulate beta-2 adrenergic receptor, which is a GS protein-coupled receptor. Protein GS stimulates the enzyme adenylate cyclase. Activated adenylate cyclase take adenosine triphosphate or ATP and removes 2-phosphate molecules, transforming it into cyclic adenosine monophosphate or CAMP. CAMP moves throughout the cytoplasm and activate protein kinase A or pKa for short. pKa then phosphorylates and inactivate myosin light chain kinase, which inhibits uterine contraction. Terbutaline can be administered orally, subcutaneously, or intravenously. Next up are the calcium channel blockers. These medications block the influx of calcium ions into the cell so that they won't be able to bind the calmodulin and activate myosin light chain kinase. The final result then is inhibition of uterine contractions. The calcium channel blocker indicated as tocolytic is nifedipine, which is one of the drugs of choice from preterm labor, and it can be given per orally or parenterally. Finally, the oxytocin receptor antagonist. Antociban bind and inhibit oxytocin receptors, blocking the signaling pathway that leads to uterine contractions.